and welcome to another class.
This is Bped 52, Physiology of Exercise and Physical Activity.
These are the following topics. First, acclimation, chronic exposure to altitude.
Second, altitude, optimizing training and performance. Third is health risk, acute exposure to altitude. So what are you waiting for? Let's start our lesson.
Hello everyone, I'm Marc Froellan Nicolas, and today I'm going to discuss to you about the acclimation, chronic exposure to altitude, and then the pulmonary adaptation, and the next is the blood adaptation. So now, first is we have a acclimation, chronic exposure to altitude. So chronic exposure to high altitude leads to gradual physiological adaptation due to lower oxygen levels, although these changes improve performance compared to initial exposure. So from the word altitude, it is a height of an object or point in relation to sea level or ground level. So for example, ani is ang Mount Everest. So muna itong ginatawag nga high altitude, or like ang Mount Apo. So that is a example gyapon sa high altitude. So now, if nata sa high altitude, so ang ato ang body or okay, so if nata sa high altitude is gakahina pud og oxygen. If nata sa taas, so mas gakahinay ang oxygen dadto sa high altitude. So that's why ang ato ang body is iyang gina-adapt ang temperature dadto, yang gina-adapt ang climate dadto, gina-adapt sa atong body ang oxygen. So ga-adjust ang ato ang body. So muna atong ginatawag pod nga acclimation. So now, the meaning of acclimation, it is a adaptation to a new climate or new temperature. So now, kay tungod kay nata sa high altitude and then kakahina pod ang oxygen, so ang ginahimo sa atong body is iyan ang gina-adapt pod dadto. Iyang gina-adapt sa atong body ang oxygen, gina-adapt sa atong body ang temperature. And then next is we have a pulmonary adaptation. So first is from the word pulmonary, it's a part of cardiovascular system that transports blood between the heart and the lungs, so which carries oxygen from the lungs to the body. So pulmonary adaptations are the changes your lungs makes to help you get more oxygen when the air has less of it, like at high altitude. So now, katungod mas gakahina pud ang oxygen nga gakakuha nato if nata sa high altitude. So ang atong lungs is muna ang reason why ang atong lungs is gaka-increase ang breathing sa atong lungs, kay para makatransport or ma-sustain niya og oxygen ang atong body. And then next is we have a blood adaptation. So blood adaptations, when exposed to high altitude, the body undergoes several blood related changes to improve oxygen delivery in low oxygen environment. And then may increase po ang ato ang erythropoietin or EPO. So now the EPO is a hormones that stimulate red blood cells production. So now, unsa day ang role sa red blood cells sa ato ang body? So now, ang role sa red blood cells, now the red blood cells increase significantly over the first few weeks. So over the first few weeks sa isa ka athlete nga naa sa high altitude, so mas may increase ang atong red blood cells. So this enhance the blood oxygen carrying capacity. So now, ang red blood cells is, ang role sa red blood cells sa atong body is muna siya ang gaka-transport og oxygen sa atong lungs to the rest of the body. So now, ang reason nga gaka-increase ang red blood cells if nata sa high altitude, so like katong giingon ganiha nga pag nata sa high altitude is gakahina pod ang oxygen. So now, kay gakahina man ang oxygen, so now ang ato ang red blood cells is gaka-increase. So now, kay gaka-increase mo atong red blood cells, so mas ma-sustain niya or mas mahatagan niya og oxygen ang atong body tungod kay gaka-increase siya.
Good day everyone, I am Neljane Mae V Opinga, and I'm gonna be discussing the muscle adaptations and cardiovascular adaptation. Now let's proceed to the muscle adaptation. So, few attempts have been made to study muscle changes that occurs during exposure to altitude. Sufficient muscle biopsy data exists to indicate that muscle undergo significant structural and metabolic changes during ascent to altitude. So the first one is the structural changes. Firstly, prolonged exposure to altitude about 2,000 to 500 meters leads to a noticeable decrease in a muscle fiber cross-sectional area, approximately 10 to 20%. So this atrophy results in a reduction of overall muscle mass. Interestingly, as muscle fibers shrink, capillary density increases. So this adaptation enhances oxygen delivery to muscle tissues, compensating for the reduced oxygen availability at high altitude. So the next one is the metabolic changes. Mitochondrial density reduction and enzyme activity declines. So on a cellular level, there's a significant reduction in mitochondrial density, particularly the subsarcolemmal mitochondria. So this loss diminishes the muscle oxidative capacity. Additionally, these activities of key glycolytic and oxidative enzymes declines, so impairing the muscle ability to produce ATP efficiently. So the contributing factors is the nutritional deficit and the hypoxia. So these structural and metabolic changes are further influenced by nutritional deficits. So the high altitude exposure often suppress appetite, leading to weight loss, about 6 kilograms over several weeks, and consequent muscle mass reduction. So the hypoxic conditions at high altitudes also limit oxygen availability, further affecting muscle metabolism. So, and unfortunately, no more biopsy data have been obtained from long-term residents at high altitude to determine whether these individuals experience muscular adaptation as a consequence of lifelong residence to these elevations. Now, let's proceed to the cardiovascular adaptation. So, when we ascend at high altitude, the air contains less oxygen, a condition known as the hypoxia. This reduced oxygen availability challenges our body's ability to perform, especially during the endurance activities. So, for this, we'll examine how the cardiovascular system responds and adapts to this condition. Initially, at high altitude, our body experiences a drop in VO2 max, which is the maximum amount of oxygen we can utilize during the intense exercise. So to compensate, our heart rate and breathing rate increases. However, our stroke volume, it is the amount of blood pump per heartbeat, decreases, and plasma volume reduces, leading to thicker blood. And over time, the body adapts by producing more red blood cells and increasing hemoglobin concentration, enhancing oxygen delivery. So the cardiac output decreases after initial adaptation. So, despite this adaptation, VO2 max often remains lower than at sea level. So, even after acclimatization, performance improvement are limited, possibly because trained athletes have already reached their maximum physiological adaptation, or because the reduced oxygen makes it harder to train at previous intensity. So, to optimize training at altitude, the live high, train low strategy is effective living at high altitude to gain adaptations, but training at lower altitude to maintain intensity. So, in summary, high altitude presents challenges to our cardiovascular system and performance. So, while the body adapts over time, these adaptations have limitations. Implementing strategic training approaches can help mitigate the negatives and optimize endurance performance at altitude. And that's all for this topic, the acclimation chronic exposure to altitude.
Such an amazing day, dear learners, and for today's topic, we have altitude, optimizing, training, and performance. We studied how our body adapts to high altitude and how it affects our performances. But can training in high altitudes can boost and can be our advantage in sea level performance? So to answer the question, does altitude training improves sea level performance? Athletes have hypothesized that training under hypoxic condition, where there is an inadequate amount of oxygen in our body, or for example, like simply breathing low oxygen, can improve our sea level endurance performance. As we all know that in the sea, there is only limited amount of oxygen. First, training at high altitude causes your body to get less oxygen. This low oxygen is important for starting the body's natural training improvement. This low oxygen signals your body to start making changes and adapt in the new condition. Second, altitude triggers the physiological changes such as increase in red blood cells, hemoglobin that can improve the delivery of oxygen. Furthermore, studies from 1960s and 1970s indeed showed that training at high altitude enhanced the performance at sea level. Live high, train low. Studies have shown that athletes who uses these methods has improved their sea level endurance and VO2 max, or their maximum oxygen in the body, compared to those athletes who uses only the high altitudes or entirely the sea level. The Live High, Train Low model was developed to maximize the benefits of altitude acclimation while maintaining high-intensity training. The main benefit appears to be the ability to combine both the physiological adaptations from living at high altitude with the performance gains from high-intensity training at lower elevations. Although for the past studies it have shown that training in high altitude improves the sea level endurance, while on recent studies it have shown differently. First is we have living and training in high altitude can reduce intensity, may cause dehydration, and also decrease in blood volume. Second, some studies have shown that stimulated altitude training, for example, hypobaric chambers, does not provide additional benefits over sea level training. Third, the effectiveness of altitude training is influenced by individual factors such as fitness level, health, and iron status. Fourth, most benefits are observed in less trained athletes, and the improvements may be transient, lasting only a few days after returning to sea level. In focus, altitude training is widely used by endurance athletes, but research does not consistently support its effectiveness for improving sea level performance. The Live High, Train Low may offer a compromise, providing some physiological benefits without sacrificing training quality. Overall, the value of altitude training for optimal sea level performance remains controversial and may depend on the athlete's background and how the training is structured. That concludes my lesson, and thank you for listening.
Good day everyone, I am Richen D Pangan, and today I will be discussing about optimizing performance at altitude. So the challenge of altitude competition. So competing at altitude presents unique physiological challenges. Even brief exposure to altitude can lead to sickness symptoms like headache, dehydrations, and sleep disturbances. So without proper acclimatization, performance suffers significantly. So there are two approaches. So first is early competition. So one approach is to compete immediately upon arrival. This minimizes altitude sickness risk but offers no acclimatization benefits. It's viable option only for short competition. And next is altitude training for optimal performance. Alternatively, altitude training provides significant performance advantages. A minimum of 2 weeks is recommended, with 3 to 6 or more ideal for complete acclimatization. This approach leads to substantially improved performance compared to immediate competition. Next, the importance of sea level aerobic training. Regardless of your chosen altitude strategy, sea level aerobic training is crucial. Weeks of intense training at sea level increase your VO2 max. This allows you to compete at altitude at a lower relative intensity, preserving energy and enhancing performances. In conclusion, choosing the right strategy depends on the competition duration and the time available for acclimatization. Prioritize sea-level aerobic training to build a strong foundation. Always consult a sports medicine professional for personalized advice tailored to your specific needs and goals. So next is the artificial altitude training, exploring methods and effectiveness. We'll delve into the world of artificial altitude training and its impact on athletic performance. Altitude adaptation is primarily driven by hypoxia or low oxygen levels. Our goal is to replicate the beneficial physiological adaptations induced by hypoxia without the need for high altitude living. Limitations of hypoxic gas breathing. So brief periods 1 to 2 hours a day of hypoxic gas breathing show no significant adaptations and insufficient to induce altitude acclimatization. So short-term hypoxic gas breathing, for example, 1 to 2 hours daily, has shown negligible impact on altitude adaptation. It simply isn't insufficient to induce the necessary physiological changes. So next is the live high, train low. So this approach remains the gold standard, alternating periods of 5 to 14 days at altitudes around 2,300 meters with sea level training yields significant positive results. Even extended sea level stays up to 11 days don't hinder adaptation if training is maintained. Next is artificial live high, train low approaches. Artificial methods like hypoxic apartments and sleeping devices attempt to simulate altitude at sea level. However, scientific evidence supporting their effectiveness remains limited. So the effectiveness and ethical consideration. Meta-analysis suggests that natural live high, train low is superior for elite athletes. Artificial methods may offer some benefits for non-elite athletes, but place effects are a possibility. Ethical concerns also exist regarding the widespread of the use of these devices. Next is the practical recommendations. For optimal altitudes performance, consider competing within 24 hours of arrival to minimize altitude sickness. Alternatively, train at altitudes between 1,500 and 3,000 meters for at least 2 weeks prior to competition. Live high, train low remains the most effective method currently available. So, in conclusion, while artificial altitude simulation is an area of ongoing development, live high, train low remains the most effective, as I mentioned earlier, and well-established approach. Further research is crucial to validate the effectiveness and safety of the artificial altitude simulation methods. And that would be all. Thank you for listening.
Good morning everyone, I am Natalia Sampilo from Bped 1A and I am here to discuss the health risk of acute exposure to altitude. So, what is acute exposure? Acute exposure is the short-term contact with a substance or something. For example, is kanang nigawas ka kadyot sa inyong balay para napaliton sa tindahan. There is an acute exposure sa sun. So, what is altitude? Altitude is the distance above sea level. So, if mo ni ang sea level of mountain dayon, mo din na ang kaning gap is mo na ilahang distance. So, ana nila a large proportion of people nga kanang hilig daw magsaka sa mga mountain to kanang bitong ang katason kay moderate to high ang katason nila altitude kay gaka-experience daw nila ang symptoms sa acute altitude or mountain sickness. So what is acute altitude or mountain sickness? It is a disorder characterized by symptoms of headache, nausea, vomiting, dyspnea or kanang maglisod ka og ginhawa, and lastly is insomnia. These symptoms can begin anywhere from 6 to 48 hours after arrival to high altitudes, and it can be severe or kanang worse in 2 to 3 days. Acute altitude or mountain sickness is not life-threatening matter, pero dili siya life-threatening matter, pero it can be incapacitating for several days or longer, and in some cases kay worse daw ilang mga symptoms. So what is incapacitating? So to better understand, incapacitating is a severe physical or psychological condition that significantly impairs the individual's ability to carry out normal daily activities or perform essential functions. So the person or the victim can develop the more lethal altitude related illness like of high altitude pulmonary edema and high altitude cerebral edema. So AAS can vary to the altitude, the rate of ascent or kanang imong pagsaka or kung saka katasun, and also the individual's experience and susceptibility. So susceptibility is the state of being easily affected, influenced, or harmed by something. They conducted some studies to determine the incidence or kanang rate of new cases ani nga sakit. So the acute altitude sickness in group of kanang mga tourists or mga novice anang mga novice climbers ba to? Something ingana mga tourists or experienced climbers. So the result vary wildly because ranging from the frequency of less than 1% to almost 60% of the altitudes of 3,000 to 5,500 meters or kanang kuan siya 9,000 to 840 to 18,000 to 45 feet ang katason. However, another study nga si Foster nag-report that 80% of the people who climb the top of Manwakia or ang iyang katason kay 4,000 to 205 meters or 13,000 to 796 feet hindi kanang makitaan to siya nga mountain sa island sa Hawaii, and na-experience daw nila ang symptoms of acute altitude sickness. So another study showed that above 2,500 to 3,500 meters or 8,200 to 11,483 feet altitudes commonly experienced by recreational skiers and hikers. The case of acute altitude sickness was about 7% of men and 22% of women, but wala daw sila kabalo sa nganong ang sex difference kay ingana. So it appears that people who experience the AAS also have the low ventilatory response to hypoxia. So na siya low ventilatory response to hypoxia. So ang hypoxia is a low level of oxygen in your body tissues. So this inadequate ventilation allows the partial pressure of oxygen or PO2 to decrease and the carbon dioxide to gather in the tissue. So muna siya. This led most of the symptoms associated with altitude sickness. So hypoxia daw is kanang mo daw na siya commonly ang cause nga nung naa siya maka-experience daw ang mga climbers of kanang altitude sickness ana. So ang pinaka-common daw nga symptoms sa associated kung magsaka ka sa mga high altitude is ang headaches. So it is rarely experienced below 2,500 meters or 8,000 feet, so above sea level. So if you move up to 3,600 meters or 12,000 feet, you will dinha daw nimo ma-experience gyud ang headache. So ana nila nga dili daw kay nimo ma-experience ang headache if napaka sa 2,500 meters. Dito na daw nimo siya ma-experience kay daghan daw a lot of people na kanang gasaka sa kuan sa mountain is around 3,600 meters gid nila ka-experience nga magsakit ang ilang ulo. Headaches is commonly kanang describe man jud na siya nga continuous throbbing in the head. O ana nila if ma-experience na nimo is kanang worse gid daw kay na siya sa morning or kanang if after ka mag-exercise. So also drinking alcohol can kay maka-worse. Kung mag-inom daw kag alcohol, maka-worse din na siya sa imong headache. So hypoxia can cause dilation of the cerebral blood vessels. Mo daw na siya ang kuan sa hypoxia sa imong lawas, sa imong utok, sa imong head. So naatay picture dun na there is a picture na magkuan siya kanang maghatag siya og kanang mga percentage og rates sa kanang kuan katong mga sakit sa high acute exposure or mountain sickness or katong happy og hase. So muna siyang iyahang percentage. So AAS can also affect our sleep. So if maka-experience daw ka og acute altitude or mountain sickness is maapektuhan gyud daw ang imong pagtulog. Bisan pa daw og tsada kay kaog tulog ana nga kuan before ka nagsaka is kuan gyud daw if ma-experience gyud na nimo is maglisod gyud daw kaog tulog or maka-experience kaog insomnia. So Chinese stroke breathing or a pattern of interrupted breathing. So known by kanang alternating period of rapid breathing and slow shallow breathing, usually including intermittent or kanang intermittent is kanang irregular periods in which breathing completely stops. So ang kaning Chinese stroke breathing is kanang maka-experience daw ka na og kanang maglisod ka og ginhawa but kuan na siya kanang paspas imong pagginhawa like ing ana tapos nya usahay kay maghinay tapos kanang taglawom dayon ka maginhawa ing ana tapos kuan din na siya kanang irregular ang imong pagginhawa tapos sometimes daw kay mo stop daw ka jud ang imong pagginhawa ing ana. So more on mag rapid breathing ka tapos mo stop na pud din siya o mo ginhawa na pud dayon ka ing ana. So this case of irregular breathing patterns increases with altitudes, occurring in 24% of people at kuan sa 2,440 meters. So kani daw is kanang di ba kung magsaka na ka og mountain is magkuan magid na kanang labi na og paana kay nga mountain iyang saka is mag-experience din na nimo din nga kuan ay dili maka-experience yun ka og Chinese stroke breathing or kanang irregular nga pag-breathing mo nga basbas na ka maginhawa throughout pag-ascend nimo sa mountain ana. So more people 20% of people daw nga maka-experience sa Chinese stroke breathing is around 2,440 meters or 8,005 feet nimo siya ma-experience. So 40% of the people kay kuan daw kanang Dito daw nila na ma-experience ang Chinese stroke breathing in 4,270 meters or 14,009 feet. Almost everyone dayon kanang halos daw tanan nga maka-experience anang Chinese stroke breathing is ma-experience daw na nila sa altitude above 6,300 meters or to 20,669 feet. So, thank you everyone for listening. That's end my discussion, and I will let teacher Sanchez to further explain my topic. Thank you.
So good day everyone. So I am April Sanchez. So today I will be the one to continue our report. So there is a question. How can athlete avoid acute altitude sickness? So there are many ways. So first, to avoid acute altitude sickness, athletes should be prioritize gradual ascents. Acute altitude sickness, even for highly athletes, is also a risk for them. It's also a risk at high altitude due to hypoxia. So when we say hypoxia, that is lack of oxygen. So ideally, no more 300 meters or 984 feet per day above 3,000 meters or 9,884 feet. So there are also a medication. So acetazolamide, a medication can be taken before ascent to help prevent symptoms, para ma-prevent ang mga symptoms, but should be used under medical supervision. So di ka pwede magpataka o gamit ani. Sometimes in combination with a steroid like dexamethasone. Severe cases require descending to a lower altitude along with supplemental oxygen or hyperbaric rescue. So the next topic is high altitude pulmonary edema. High-altitude pulmonary edema or HAPE is much more serious condition involving fluid built up in the lungs. So very serious condition siya. It's also a life-threatening and caused by hypoxia leading to blood clots and fluid leakage in the lungs. So when we say hypoxia, lack of oxygen, but because of lack of oxygen, it could cause to blood clots and fluid leakage sa lungs. So this is more common in people who ascend rapidly to altitude above 2,500 meters or 8,202 feet, and affects even healthy individuals. So it can also affect healthy individuals with a higher incidence in children and young adults. So symptoms include shortness of breath, cough, muna siya ang mga symptoms, chest tightness, and fatigue. So pag makafeel na ka o short of breath, ubo, chest tightness, and fatigue, that are the symptoms. Severe cases can lead to cyanosis or bluish skin, confusion and loss of consciousness. So treatment involves immediate supplement oxygen and descent to a lower altitude para ma-prevent siya. Next is high altitude cerebral edema. So high altitude cerebral edema or HACE is a serious potential fetal condition where the brain swells due to the effect of high altitude. So it can also affect your brain. It can swell your brain. It's often a late stage and end stage, so manifestation of acute mountain sickness or AMS, and can progress to coma and death if not treated promptly. So, pwede yun siya nga ma-end imong life, ani. That's all for today, guys, and thank you. God bless.